Hey guys, in this video we're going to be looking into the clinical roles and staff you'll see in a hospital and what they're called in Japanese. I'll break down some of the vocabulary and give you a few memory tips on how to remember these Japanese words. So let's get straight into it. So the first one is a doctor or physician, and there are a couple of Japanese words you'll commonly encounter for this. The first one is the formal title of a doctor, which is ishi. Breaking the kanji down, you have the kanji for I, which means medical. This is a kanji you'll see regularly in any word that is related to anything medical. And following I is the kanji shi, which means expert. This is a kanji you'll often see for words that refer to someone that's a specialist or a teacher, such as kyoshi, which means teacher, or koshi, which means lecturer. So putting the kanji together, the word is ishi, which means doctor. Another word for doctor, and I'd say the more commonly spoken word, is isha. Breaking the word down, we have the kanji for medical in I, and the kanji sha, which is often used as a suffix with a qualifying meaning person. So putting it together, it is isha, or medical person, which means doctor. And just a tip here on the difference between the two words. Ishi is the official name of the profession, whereas isha is a little less formal and used more in regular conversation. So ishi, I would say, is more seen or used in official settings, such as occasions or forms or paperwork where they're stating their title, whereas isha is more widely used when referring to a doctor in general conversation. I've also broken down a couple of broad specialties of the medical profession. So broadly speaking, you have two types of doctors. You have an internist, or a doctor specializing in internal medicine, which in Japanese is naikai. Breaking the kanji down, you have the word naika, which is the word for internal medicine. Breaking the kanji up even further, you have the first kanji highlighted in blue, nai, which means inside or internal. And the next kanji is ka, which has multiple meanings, one of which means branch of study. So if you remember the two kanji meanings individually, when put together you can see that nai, together with ka, would make internal branch of study, which you can link back to internal medicine. We also have the kanji I, which meant medical in the words isha or ishi for doctor, but in this context, the kanji for medical means doctor, with this meaning often used when the kanji I is used as a suffix. So putting all the kanji together, it is naikai, or internal medicine doctor, or an internist. So the next type of doctor we have is a surgeon, which is gekai. Breaking the kanji down, we have the word geka, which means surgery, and the kanji I, which again in this context means doctor, making gekai, or surgery doctor, which is a surgeon. Like I did with nai, I've highlighted the kanji for ge in blue as a memory tip to remember both naikai and gekai by remembering the first kanji. The kanji nai is the kanji for inside or internal, and the kanji ge means outside or exterior, so knowing the meaning of the first kanji may help you remember and differentiate the two words from each other. The next roles we have are the nurses, and the word for nurse being kangoshi. Breaking it down, we've got the word kango, which is the word for nursing, and the kanji shi, which means expert or teacher. So altogether it is nursing expert or kangoshi, which means nurse. We also have licensed practical nurses, which in Japanese is jun kangoshi. Breaking the kanji down, we have the kanji jun, which means semi or associate, and together with the word kangoshi, which we just covered, making semi or associate nurse, which is jun kangoshi, or a licensed practical nurse. And just a quick tip, kangoshi generally refers to a registered nurse or an RN, whereas jun kangoshi refers to a licensed practical nurse. Next we have an assistant nurse, or kango助手. Breaking the kanji down, we have kango, which means nursing, and joshu, which means assistant, making nursing assistant or kango joshu. So a very little translation there. We also have public health nurses, and the word for that is hokenshi. So the kanji making this word is first hoken, which means health preservation. Then combined with shi, which means expert or teacher, we have health preservation expert or hokenshi, which is a public health nurse. And just a tip that remembering one of the key roles of a public health nurse, which is to prevent disease and preserve health, may help you remember the Japanese word, as the role of the position is embedded in the word itself. Also, breaking up the kanji for hoken may help with the first kanji ho being a kanji often used for words meaning preserve, and ken being the kanji for health as seen in the word kenko, which is the word for health in Japanese. Next we have midwife, which is josanshi. Breaking the word down, we have the kanji for midwifery, which is josan, together with the kanji shi, meaning expert, making midwifery expert or josanshi, which means midwife. And a memory tip, the kanji for midwife is made up of two kanji, the first being jo, which means assist, and san, which means birth, making the kanji for midwifery a very literal translation of the role of the midwife. Pharmacist is the next one, and the word for that is yakuzai-shi. Breaking the kanji down, we have the kanji yakuzai, which means medicine, together with shi for expert, which together is medicine expert or yakuzai-shi, which means pharmacist. And just a little side note, another word for medicine is kusuri, which uses the same kanji as yaku in yakuzai. Kusuri is the word you'll more commonly hear in day-to-day Japanese to mean medicine. The difference between kusuri and yakuzai is that kusuri can refer to a whole spectrum of drugs, whether it's prescription medication, supplements, illicit substances, etc., whereas yakuzai specifically refers to drugs produced and released by pharmaceutical companies. Next we have a clinical laboratory technician, and the word for that is臨床検査技師. Breaking the kanji down, we have臨床検査, which means clinical examination or laboratory test. You can divide the kanji up even further with 臨床, the first two kanji characters meaning clinical, and検査, the last two kanji characters meaning examination or screening. These are two handy words to remember as you will often come across them in medical Japanese. So after 臨床検査, we have gishi, which means technician. Looking at gishi, we can see it's made up of two kanji, the first being the kanji gi, which means skill or technique, and the kanji shi, which we've seen many times prior, meaning expert, which combined together makes gishi, which means technician or engineer. So combining all the kanji together, we have laboratory test technician or 臨床検査技師, which means clinical laboratory technician. Next we have radiation technologist, and the word for that is 診療放射線技師. Breaking that down, we have 診療, which means medical care, 放射線, which means radiation, and gishi, as we saw prior, means technician, making medical care radiation technician or 診療放射線技師, which means radiation technologist. Now we'll go into some of the allied health roles, and we first have physical therapist, which in Japanese is 理学療法士. Breaking the word down, we have the kanji for physical science, which is 理学. We have 療法, which is the word for therapy, and shi, which is a different kanji to the shi we've been seeing. This shi is a kanji that has a few meanings, one of which is a person in a certain profession. So it's used similarly to the shi that means expert or teacher that we've been using prior. So together it's physical science therapy person or 理学療法士 or physical therapist. Next we have occupational therapist, and the word for that is 作業療法士. Breaking the word down, we have 作業, which means occupational, 療法, which we've covered meaning therapy, and shi, meaning person of a certain profession, together making occupational therapy person or 作業療法士, which means occupational therapist. Speech pathologist is the next one, which is 言語聴覚士. Breaking the word up, we have the kanji 言語, which means speech or language. Then we have 聴覚, which is sense of hearing, and shi, which is a person of a certain profession, making speech or language sense of hearing person, or 言語聴覚士, which is speech pathologist. And finally we have dietitian or 管理栄養士. Breaking the kanji down, we have the kanji for management in 管理, the kanji for nutrition 栄養, and shi, the kanji for person of a certain profession, making 管理栄養士 or management nutrition person, which describes the role of a dietitian. And that's the end of the video. I know it didn't cover every clinical role in a hospital, but it's touched on some of the main ones. I may make another video down the line which is a little more comprehensive or maybe look further into certain departments or clinical areas. Anyway, I hope you got something out of the video. Thank you for watching.